Have you ever stopped to wonder what it actually feels like to live with a mental health condition or to navigate the really intense impacts that substances can have on the human body? We're not talking about textbook definitions here. We're talking about the day-to-day, minute-to-minute reality. Because these invisible battles, they can really slowly close in on a person. So today, we're breaking down what these unseen struggles actually look and feel like.
Welcome to this explainer. Over the next few minutes, we're going to analyze how both our internal brain chemistry and external substances completely reshape our central nervous system, and ultimately our everyday lives. And just to be clear up front, this isn't about slapping labels on people. It's about deeply, genuinely understanding the human experience.
Okay, let's dive into this roadmap. First, we'll cover when the alarm malfunctions, then extremes of energy and mood. From there, we'll shift to external impacts with slowing down the depressants, followed right up by accelerating and altering reality. And finally, we'll wrap up the whole shebang with empathy, support, and recovery.
Section 1. When the alarm malfunctions. We're looking at anxiety, PTSD, and OCD.
Think of anxiety like this. It's basically the brain's built-in alarm system firing off when there is absolutely zero real danger. Or it's massively overreacting to a threat that's actually tiny. For someone with generalized anxiety disorder, it's a constant low-grade worry about things that are objectively fine. And let me tell you, it is completely exhausting because the brain literally never switches off. Then you have social anxiety. This is an intense fear of being judged that makes someone absolutely dread a simple phone call or find themselves mentally rehearsing totally basic sentences. In panic disorder, that brings these sudden, terrifying waves of intense fear, racing heart, shortness of breath, without any actual threat present. In daily life, this constant loop of worry just drains you, essentially shrinking a person's entire world.
Now, with post-traumatic stress disorder or PTSD, totally ordinary situations can suddenly feel incredibly unsafe. This is because of hypervigilance, which is essentially a constant, draining sense of being on high alert. Because of that, something as simple as a loud noise, a particular smell, or a specific place can trigger a massive flood of distress that's tied directly back to an original trauma. It heavily impacts a person's ability to just feel secure in everyday environments.
Now, what's really interesting and tragic about obsessive-compulsive disorder, or OCD, is that it operates in this continuous, exhausting loop. Just think about this cycle. It starts with an intrusive obsession, some unwanted thought causing intense distress, like an overwhelming fear of contamination. That distress reads straight into a compulsion, which is a repetitive behavior like excessive hand washing or constantly checking locks, and it's done just to get some temporary relief. I mean, it's not just about being neat, right? It is a relentless, time-consuming cycle that can eat up hours of a person's day and severely interfere with basic everyday functioning.
Moving smoothly into Section 2, extremes of energy and mood, navigating highs and lows. So there's a really stark contrast between these two major conditions. On one side, you've got major depressive disorder. And listen, this isn't just being sad. It is a persistent, heavy, invisible numbness. It drains your energy so much that simple tasks like taking a shower or just replying to a text can feel like climbing Mount Everest. Someone can smile and function outwardly while feeling completely hollow on the inside. On the other side of the spectrum is bipolar disorder. This involves huge shifts between that exact same heavy depressive low and massive euphoric manic highs. During a manic episode, a person can be totally unpredictable, they take big risks, talk a mile a minute, and barely need any sleep. The daily reality here is just the sheer unpredictability of swinging wildly between these two extreme states. Next up is ADHD, which, by the way, affects a lot of adults, not just kids. It is absolutely crucial to understand that ADHD is not a lack of effort, and it's definitely not a lack of intelligence. It's actually a difference in how the brain regulates itself. A person's attention is automatically hijacked by whatever is most stimulating in that exact moment. That means they really struggle to sustain focus on less engaging tasks, which leads to missed deadlines, completely losing track of time, and impulsivity. Honestly, it's more about an inability to regulate focus rather than an inability to focus at all. We also definitely need to touch on eating disorders, including conditions like anorexia and bulimia. These are incredibly complex conditions, revolving around food, body image, and a need for control. But the thing is, they are rarely just about food. They're actually deeply connected to underlying emotional distress, and they carry some incredibly serious physical and psychological risks that we just can't ignore.
All right, Section 3. Slowing down. The depressants. Let's look at external impacts on the nervous system.
So, switching gears to external substances. Depressants generally work by physically slowing down the central nervous system to produce feelings of relaxation or drowsiness. Alcohol is obviously the most widely used here, and it's responsible for some massive preventable health problems. Then you have benzodiazepines, which are prescription meds for anxiety, but they carry a very real risk of physical dependence. And opioids, they are highly dangerous because at high levels, they literally tell your brain to stop breathing. The absolutely crucial takeaway here is that the line between a therapeutic or social effect and a highly dangerous one is remarkably thin, especially when you start mixing these substances together.
So why exactly are opioids at the center of a massive public health crisis? Well, it really comes down to opioid tolerance. The brain actually adjusts to the physical presence of the drug over time. It gets used to it, so it requires more and more of the substance just to achieve that exact same pain-relieving or rewarding effect. And because opioids severely suppress breathing and trigger extreme physical withdrawal, quitting without medical support is just incredibly difficult. Dependency here is a very real medical condition that requires professional treatment. It is absolutely not just a matter of willpower.
Let's move to Section 4 and see how this builds, accelerating and altering reality. Stimulants and hallucinogens.
Now, unlike depressants, stimulants speed up activity in the central nervous system. We're talking elevated heart rate, high alertness, and a huge burst of artificial energy. Caffeine is a mild one, and it's generally safe in moderation. Prescription stimulants like Adderall are great for helping regulate attention for ADHD, but they can cause dependency and high blood pressure when they're misused. And illegal stimulants, things like cocaine and methamphetamine, they carry severe, immediate risks of heart attack and stroke. The bottom line here is that the human body simply cannot sustain this kind of artificial cardiovascular strain and jacked up energy long term. The damage really adds up.
Then we have hallucinogens. Think substances like LSD and psilocybin mushrooms. Now, unlike the depressants and stimulants we just talked about, hallucinogens typically don't carry a high risk of physical addiction. But their psychological unpredictability is where the real risk lies. What people call a bad trip involves intense fear and paranoia. And for vulnerable people, this psychological unpredictability can actually trigger some very serious, long-lasting psychiatric episodes.
It's also worth comparing two incredibly common, yet completely different substances. On one hand, we have cannabis. For most adults, occasional use carries a relatively low physical risk. However, there are very real mental health risks for adolescents whose brains are still developing, and for anyone with a family history of psychosis. On the exact opposite end, we have nicotine, literally one of the most addictive legal substances on the planet. Its true danger lies in how strongly it reinforces a highly addictive habit loop of use and craving, combined with incredibly dangerous delivery methods, like combustible tobacco, that are directly linked to cancer and heart disease.
Bringing us to our final chapter, Section 5, Empathy, Support and Recovery. The human element.
So the crucial point is this. If you take away absolutely nothing else today, please let it be this. These mental health conditions and substance dependencies are real, highly complex, and often entirely invisible struggles. They fundamentally alter how a person thinks, feels, and functions every single day. They are not character flaws, and they are certainly not just matters of willpower that someone can simply snap out of.
Recovery does not happen in a vacuum. It doesn't happen in isolation. It affects entire families, workplaces, and communities. By truly understanding the factual realities of how the brain and these external substances actually work, we can dramatically reduce the stigma surrounding them. If you, or maybe someone you know, is struggling with mental health or substance use right now, please reach out to a professional or a confidential helpline in your country. You really do not have to go through it alone.
Understanding replaces stigma with empathy. Now that you've seen firsthand how these invisible battles operate on both the mind and the body, I have a question for you. How will you apply this knowledge to foster a more supportive and empathetic community? Think about it. Thank you so much for joining me on this explainer. Keep learning, and please, keep looking out for one another.